Good morning students. Myself Dr. Lokesh Sharma, Associate Professor, Mahatma Gandhi Physiotherapy College. Today I am going to teach you about passive movement. So what is passive movement? These movements are produced by an external force during muscular activity or when the muscular strength is not sufficient to produce voluntary contraction. Means whenever these movements are produced, voluntary contraction of person or that patient is not used to produce this movement. So these are involuntary movements done by basically by the therapist. So classification of passive movement. First, relaxed passive movement including accessory movements. Second, forced passive movement. Third, continuous passive movement. So first is relaxed passive movement. So what is relaxed passive movement? So definition: these movements performed accurately, rhythmically and smoothly by the physiotherapist through available range of motion. So these movements are produced by the physiotherapist और किसमें whatever range of motion is available, in that range of motion only these movements are produced according to anatomy of joints. The movements are performed in the same range and direction as active movements. So passive movements are produced in same direction and same range what we used to produce in active movements. The joint is moved through the free range and within the limit of the pain. So whatever range of motion is available, in that range of motion only these movements are produced and within the limit of pain. Means till that time we have to produce passive movement. If pain is occurring, then we have to stop the passive movement in that range only. Principles of relaxed passive movement. So what are the principles of passive movement? First is relaxation. The selection of a suitable starting position ensures comfort and support for both patient and physiotherapist through the movement. So patient should be completely relaxed position. With patient, the therapist should also be relaxed. Then second is fixation. Good fixation for the proximal and distal joint by the physiotherapist to ensure that the movement is localized to the movable joints. So while passive movement, the proximal joint should be fixed, or we can say proximal bone has to be stabilized properly. So the effort, whatever effort we are producing, should be producing the same joint in which we require the improvement or movement. The third is support. Full and comfortable support is given to the part to be moved so that the patient has confidence and will remain relaxed. So while giving passive movement, the patient support is required. Why? If patient is not supporting to us during movement, then he will try to produce voluntary contraction or he will try to stabilize his movement or restrict his movements. So patient support is fully required while these movements, so we can perform these movements easily. Then next is traction. The fixation of the bone proximal to the joint, providing an opposing force and sustained pull on the distal bone. Traction is thought to facilitate the movement by reducing interarticular friction. So traction. So while we are giving passive movement, first we have to produce traction. So what traction will do? It will increase the joint space and reduce the articular friction. What articular friction? That is interarticular friction. So the movement can be easily produced and there will not be any restriction to the movement if friction is reduced. Then next is range of movement. The range of movement is done in painless range to avoid spasm in the surrounding muscles. So whenever we are producing passive movement, there should not be any pain while movement. So we have to produce the movement within the painless limit. Why pain is producing? Because if there is any injury, so surrounding muscle will undergo in spasm. So that's why if pain is producing, the patient, what we will do, he will try to restrict the movement. Then next is speed and duration. As it is essential that relaxation is maintained throughout the movement, the speed must be slow and rhythmical with suitable repetitions of the movement. Then patient should be in completely relaxed position and the speed and duration of the movement should be equal. It's not like that one movement you are doing fast and another is doing slow. So you should maintain the speed and duration throughout the treatment. Then what are the effects and uses of relaxed passive movement? The first effect and use is maintain range of motion and prevent formation of adhesion. So why it is maintaining range of motion and preventing adhesions? Because if somebody is bedridden and patient, he is not moving his joint, then his physiological limits of muscle and joint is reduced. So while performing movement, what we are doing, we are maintaining the physiological properties of muscles and maintaining joint physiology also. So nutrients are supplied to the joint and surrounding structures. So in this form, it will prevent the formation of adhesion and maintains the joint range of motion. Then next is maintain the physiological properties of the muscle, that is extensibility, elasticity, and prevent shortening and contraction. So while moving throughout the range of motion, what we are doing, we are slightly stretching the muscle. So if we are stretching, then muscle is not getting contracted and shortening. If person is bedridden and he is not doing any movement, then what happens, that his muscle undergoes in shortening and further contraction. Then third is help in preserving and maintain the memory of the movement pattern by stimulating the kinesthetic receptors. So while we will move patient's joint, so what is the joint containing the kinesthetic receptors? So during passive movement, we are stimulating the kinetic receptors also. Like what these kinetic receptors do, they maintain the joint range of motion sensation, position of joint sense, and which direction joint is moving. So these are the role of kinesthetic receptors. Then fourth is the mechanical pressure results from the stretching of the thin walled vessels which passing across the moved joint will assist the venous and lymphatic return. So while we are moving the joint, what is happening in our venous and lymphatic drainage? The venous and lymphatic drainage is increasing and improving the circulation. Can be used in training of relaxation, as the rhythmic continuous passive movement can have a soothing effect and induce further relaxation and sleep. So passive movement also helps in relaxation and soothing effects. So patient become relaxed. Improving sense of position and sense of movement. So we have studied that same kinesthetic receptor are stimulating. So these are helping in improving sense of position and sense of movement. Indications of relaxed passive movement. In case of paralysis, patient who is confined in bed for long time or complete rest on bed. So paralysis patient we can give. When there is an inflammatory reaction and active movements is painful. If patient is moving actively his joint and it is painful, then we can go for passive movement. When the patient in coma, if patient is coma, then he cannot move. So passive movement is helpful in relaxation as a factor helping to reduce spasm in group of muscles. Then contraindications. Unhealed fracture, recent fracture at the site of fracture, at the site of effusion or swelling, immediately following surgical procedures to tendon, ligament, joint capsule, immediately after recent tear to ligament, tendon, when a bony block limit joint motion, example myositis, ossificans, recent injuries, severe muscle weakness, acute inflammation or infection as arthritis and osteomyelitis. So these were about passive movement. Thank you very much.